Imagine that over 6 million people in America are currently living with heart failure, many of whom have never even considered that simple swelling in the ankle or persistent coldness in the toes could be a cry for help from a tired heart. The frightening truth is that heart failure doesn't always present itself with severe chest pain. Often, it begins quietly and subtly, with symptoms that we easily attribute to age, being overweight, or even just a long day on our feet. Ankle swelling that occurs daily, which you blame on your shoes. Feet that constantly tingle, which you think is due to sitting for too long. We would love for you to share in the comments where in the world you are following us from. Remember, the path to a healthy life starts right now, by recognizing the signs that may be your heart's only opportunity to signal for help. Today, we are going to examine 6 scientifically proven signs that appear specifically in the feet and calves, the very places where many people least expect them. These symptoms are more than just common discomforts, they are, in fact, the emergency warning system of your body. Medical research has shown that each of these signs is directly related to a decrease in the heart's pumping ability and its gradual failure. Timely diagnosis can mean the difference between a healthy life and a serious crisis. The first important sign is unusually cold feet. Many people take this lightly, attributing it to thin socks or poor circulation. However, in heart failure, the situation is different. When the heart no longer has enough strength to pump, it must redirect its limited blood supply to more vital organs such as the brain, heart, lungs, and kidneys. As a result, the extremities, especially the feet, are given the lowest priority. A study published in the prestigious journal Circulation has extensively examined this phenomenon. The findings indicate that patients with reduced cardiac output consistently complain of cold extremities, and in most cases, the feet are affected more than the hands. The reason is simple: the feet are the farthest from the heart, and supplying blood to them requires more energy. An important distinction to note is that the coldness caused by heart failure is not like ordinary coldness. Normally, with movement or by wearing warm socks, the feet warm up again. However, in this condition, even with warm clothing or when the rest of the body is comfortable and balanced, the feet remain cold. Many patients have described this sensation as feeling like, "My feet are always frozen in ice." Second sign, pitting edema. If you have noticed that your calves or ankles are swollen, you can perform a simple test that doctors also use. Press your finger firmly on the swollen area for about 10 seconds and then release. If the indentation from your finger remains for a few seconds and a deep pit is formed, you are experiencing pitting edema. This type of swelling is not just simple swelling, it indicates a specific accumulation of fluid in the tissues, telling an important story about your body's internal condition. Research published in the American Heart Journal has shown a direct connection between this condition and right-sided heart failure. When the right side of the heart weakens, it can no longer effectively pump the blood returning from the body to the lungs. What's the result? Blood accumulates in the body's venous system, and the extra pressure causes fluid to leak from the vessels into the tissues. The indentation you see on the skin is actually the displacement of this accumulated fluid. Muscle weakness in the legs. Recent groundbreaking research published in Circulation has shown that patients with chronic heart failure often experience weakness in their skeletal muscles, severely limiting their physical performance. This is not just ordinary fatigue, it represents a fundamental change in the muscle's ability to contract and perform work. When the heart loses its ability to effectively pump blood, the leg muscles do not receive enough oxygen and nutrients. Studies indicate that heart patients have a reduced amount of myosin heavy chain protein in each muscle fiber, which leads to decreased effective contractions of the muscles. This reduction in protein specifically disrupts your ability to perform activities such as climbing stairs, walking long distances, or any task that requires leg strength. The study found that patients with more severe heart failure had weaker leg muscles and experienced greater muscle weakness even after light activities. An important point is that this muscle weakness persists even after heart function improves with treatment. This means that the structure of the muscles has undergone permanent changes and does not fully return to its previous state. Weight gain due to fluid retention in the legs and calves. You may be surprised when you step on the scale to find that you've gained several kilograms in just a few days, or perhaps 5 to 10 pounds in a short period. If this weight gain is accompanied by swelling in the legs and calves, it should not be confused with weight gain from fat. In fact, this sign indicates your body's urgent effort to cope with heart failure. A study published in Mayo Clinic Proceedings has introduced this rapid weight gain due to fluid retention as a serious medical warning. This issue is not just about the numbers on the scale, it reflects a serious disruption in the body's ability to maintain fluid balance. Unlike gradual weight gain from eating food, fluid retention can lead to significant weight gain in a short time. Some patients have reported gaining 10 to 15 pounds in just 1 week solely due to fluid. This weight often accumulates in the lower body, causing pants to become tight around the calves and even making your shoes no longer fit. Darkening or bluish color of the legs, cyanosis. If you notice that the color of your legs has alarmingly changed to blue or gray, this condition is called cyanosis and is one of the most prominent and important medical signs indicating that your heart is having trouble maintaining adequate blood circulation. A study published in ESC Heart Failure has identified cyanosis as a critical and peripheral sign of heart failure. This condition occurs when deoxygenated blood predominates in the circulation, especially in areas where blood flow is slower or where blood pools. The bluish color initially appears in the lowest parts of the body, the calves, ankles, and feet. As heart failure progresses, this discoloration becomes more pronounced and persistent. The color may spread from the toes upward toward the lower legs and is typically more noticeable when sitting or standing for long periods. This change in color indicates a critical state of circulation and its profound impact on oxygen delivery to the tissues, and it should never be ignored. Swelling of the ankles. Ankle swelling is one of the most noticeable and early warnings of heart failure. When the heart weakens, it can no longer effectively pump blood throughout the circulatory system. This leads to increased pressure in the vessels, as blood backs up and accumulates from the weakened heart. A study published in JCC Heart Failure confirms that ankle swelling is not only one of the most common early symptoms of heart failure but also one of the most reliable predictors of disease progression. When blood pools in the vessels, the extra pressure causes fluid to leak from the vessels and enter the surrounding tissues. The ankles are typically where this fluid accumulates, as gravity naturally causes it to collect in the lower body. The concerning aspect is that this swelling usually does not go away with rest or by elevating the legs, rather, it remains persistent, gradually worsening, and becomes more noticeable throughout the day. Restless legs at night. When you go to bed at night to rest, your legs feel like they have a will of their own, they start to move, cramp, and create an indescribable need to move. Research published in Sleep Medicine Reviews shows a connection between this condition and heart failure. During the day, when you stand or walk, fluids accumulate in the lower body and legs due to inefficient circulation. However, when you lie down at night, these fluids begin to move again and redistribute throughout the body. The return of excess fluids from the legs to the central circulation can cause nerve compression, alter electrolyte balance, and create uncomfortable sensations that the brain interprets as an urgent need to move. This nighttime fluid shift compresses the nerves, leading to symptoms such as burning, tingling, or a crawling sensation. Additionally, the impaired circulation caused by heart failure means that the tissues in the legs already struggle to receive enough oxygen, and this nighttime fluid shift can exacerbate that issue. Awareness is the first step in caring for ourselves and our loved ones. If you found this video helpful, please share it with others. This simple information might save someone's life. Until next time, stay informed and healthy.